How are we all going out there? Eric Backer here. How's it going? From New Zealand, lovely sunny downtown New Zealand. I'm a naturopath and I'm the author of Candida Crusher, and I'm also the formulator of the CanXida range of dietary supplements. I've got another case history for you here. This is another chronic vaginal thrush case. This is a lady called Tracey, 48 years old. Tracey came to my clinic after many years of seeking help for vaginal thrush that had plagued her since she was 18. 30 years of thrush, imagine that. Almost all of her adult life. The first thing I noticed was how depressed and anxious this patient was. She clearly didn't look happy, and I wasn't sure if she was ready to take my advice. After all, she had been to so many doctors and other healthcare professionals. I was just another person along the chain she came to for advice. So these patients called doctor hoppers, they hop from one to another. However, the difference in this case was that I had seen a younger sister of Tracey 6 months prior, before she came to see me. Patricia from California had come over to stay with Tracey for a while and had come to see me with a recurrent urinary tract infection that had been causing her concern. We soon cleared this up, and it gave Tracey the confidence to come and see me. Tracey's yeast infection was chronic and had caused her so much concern that she'd not had a relationship for over 10 years. Something I found incredible. The first several consultations were difficult because Tracey cried and displayed much grief and anger over a complaint which was wrecking the quality of her life, and at one stage had become suicidal because no one could help her. Well, I can tell you what, I can relate to Tracey, because that's exactly how I felt when I had Candida. This woman couldn't find any solutions, and nobody was interested in helping her. Antidepressants were offered with sleeping pills. What a mess, this case. Like many chronic cases, Tracey started on the oral contraceptive pill in her late teens and stayed on this drug for over a decade. She drank copious amounts of alcohol, smoked cigarettes, and worked rotating shifts as a nurse from 20 up till she was 38 years of age. Her lifestyle was very stressful, and she liked work in the emergency ward of the hospital because she enjoyed the buzz. Meanwhile, her health had deteriorated as her adrenal glands became increasingly burnt out, and her immunity suffered due to this hectic and stressful life. Her boyfriend at the time was a doctor who would routinely give her antibiotics. And over the years in the hospital, she must have taken over 100 rounds of antibiotics. Imagine that. What the hell was I going to do with Tracey? The most challenging thing I find was to try and break through to the patient and give them confidence. And particularly with her, right, was to show her that her body could and would right itself if the correct conditions were met. But it would take a lot of time to repair the damage. And this damage occurs on many levels, including emotional and spiritual and physical. You see, when you have slowly developed a seriously chronic case of yeast infection like Tracey over the years, it will first affect you on the physical plane. Fatigue, thrush, recurring infection, etc. And slowly but surely, as your health improvements are not forthcoming, after seeking expert help, it will begin to affect you on the emotional plane. Grief, anger, and anxiety. This explains why many chronic cases that have come to me with a plethora of drugs and supplements often also include the mind supplements like sleeping pills and antidepressants, right? I worked with Tracey for 1.5 years, and what I noticed was that with each visit from about 9 months into the program, her mental and emotional disposition changed for the better. It made me quite emotional myself to see a woman who, looking old before her time, go literally from a wilting flower into full bloom. Her smile became radiant, and you could even see the change in her posture. Her new wardrobe was a reflection of how she was starting to feel inside, full of hope for a beautiful new life. I love cases like this, and they reconfirm what I really started to take note in the last 10 years of my work, that it's critical to see this deep inner change if you expect a full and complete recovery. I had Tracey on various dietary supplements as well. I had her on a multivitamin, and at that stage I hadn't developed up my CanXida Remove, which I now have. Tracey would have shortcut her treatment process significantly by using expertly designed dietary supplements. So the CanXida range currently is CanXida Remove. CanXida Remove is the best antifungal you're going to find on the market, hands down. I guarantee you won't find a better product. The second product which I've created, which will come out very soon, is called CanXida Restore. I've picked the best enzymes and the best probiotics and combined those together. And that should hopefully be released around about June or July 2015. It's going to be a stunning product, and it's a perfect companion with the CanXida Remove. So if you can relate with Tracey, if you can relate with chronic vaginal thrush, if you can relate with the pill, antibiotics, you know, very bad sex life, multiple relationships, I want you to think of this thing. There is hope for you. You can recover. If you apply the right principles and you apply them long enough, you will fully recover this condition. I had three cases today with vaginal thrush. Two in particular were quite severe and chronic. And one lady, I basically said to her, look, the hardest thing for me to do is to make you understand that you need to keep thinking on the positive of this thrush, you know. Think about how wonderful your relationship with your husband's going to be like when you do conquer this thing. See it as not as a curse, but as a blessing, because it's taught you perseverance. It's taught you commitment. It's taught you that you can, if you apply yourself with clearly defined principles for long enough, you're going to get an outstanding result. You're going to feel amazing. And you're going to have a better sex life than you ever had in the past. And I could see that she started to think, well, maybe it's not so bad after all. Remember, when you think about something in a not so good sense, it's going to affect the outcome significantly. When you're positive about something and you really want to achieve a fantastic outcome and the mind is on the right track, you're going to get the outcome much faster than you ever had anticipated. All right? So never forget, the self-talk is critical when it comes to overcoming chronic thrush. Okay? Because I know that you're feeling embarrassed. I know that you're feeling humiliated and ashamed, and you probably feel disgusted with yourself. But the thing is, that's feelings, and you can overcome these feelings. You have to be strong for yourself inside. And a lot of people may not support you, but you can support yourself. Okay? I've helped lots of women like you overcome this chronic condition, and you can overcome it. It's highly achievable. Don't forget to do my quiz, CanXida.com. Check out my book, CanXida Crusher. It was written for women just like you. And also, please consider the CanXida range of dietary supplements at CanXida with an X, CanXida.com. Thank you for tuning in.